We're shifting focus now in a significant victory for child health and consumer safety. An 8-year-old long solitary campaign waged by a Hyderabad pediatrician has reached a decisive stage, with Food Safety and Standards Authority on Wednesday issuing a directive banning the use of the term oral rehydration salts or ORS by beverage products. Senior pediatrician Dr Sivaranjani Santosh has led the fight against the manufacturers retailing their beverages as ORS. Her advocacy stresses a vital point, which is that ORS is a specific drug formulation with a precise balance of salts, glucose, dextrose that ensures rapid, effective fluid absorption. The lost straw in this ongoing battle over ORS label appears to have been the Madhya Pradesh incident, where several children died after consuming contaminated cough syrup. Joining me on the broadcast is Dr. Sivaranjani Santosh, pediatrician who has been campaigning against mislabeled ORS brands. Ma'am, thank you for joining us, and congratulations firstly for this long battle finally coming to an end, and your first comments on this.
Thank you very much. I'm very happy the feeling has not still sunk in. It was very unexpected. I mean, I was thinking that it will happen, but I didn't expect it to happen that day. And yeah, I'm so relieved, so happy, so thrilled.
Ma'am,
so emotional.
We are also seeing that diarrhea has been, one of the leading causes of childhood mortality in India. That's what actually made you start this campaign. How do you look at this entire battle in India?
See, diarrhea accounts for 13 out of 100 deaths in the under 5 age group in India. And oral rehydration solution is the magic wonder drug of 20th century, which has saved millions of lives by rehydrating the children in the right way. So rehydration is cornerstone to getting the child recover. Okay. So we are supposed to give WHO recommended formula ORS only. We are supposed to give WHO recommended formula ORS only. But many companies, especially it started with Jagdale, later purchased by Johnson, and later spin-off company Kenvue. They owned this ORS trademark. These drinks. And later, Reddy Labs came up with Rebelance with ORS. Last year, Zydus came up with Glucon-D Active ORS. And many other things like ORS Fit, Ind ORS. All these have anywhere from 8 to 10 times the sugar that is recommended as per the WHO recommended formula ORS. And this extra sugar worsens the diarrhea. It's like basically you're getting something, a medicine, thinking that it is going to improve your child's condition, whereas this will actually worsen your child's condition and ends up in the situation where your child will be hospitalized, and diarrhea can lead to death, dehydration can lead to death.
Doctor, was there a very particular incident that actually, made you take up this campaign?
Actually, to start with, there was no particular incident. It was an observation that the children I was treating, their diarrhea was worsening. So when we raised this point, this company people at that time, it was with Johnson & Johnson, they finally added a micro mini disclaimer, do not use during diarrhea. But they continued to sell it in every pharmacy, every school, every hospital. Even doctors weren't aware of this deception.
Right.
And later, yeah, tell me.
Doctor, we want to understand, to break it down for our viewers, how do we differentiate between these, ORS which has been approved by the WHO and which are, fake, or they can, cause
It will have WHO recommended formula written on the label very clearly. It will have WHO recommended formula written on the label clearly. And there won't be any FSSAI mark. There won't be any FSSAI mark. They'll have only a registration number which would have been given by CDSCO. Here on these labels, there won't be anything like WHO recommended formula ORS. And they will have the FSSAI mark. Where's that? Let me see, I'm not able to find that. Yeah, they would have given, FSSAI would have given permission.
right.
Okay, right? So that's how we identify. But if government implements this rule and if these are going to go away, they are supposed to go away, then there won't be any confusion only. There is only one ORS, that is WHO recommended formula ORS. And only CDSCO can give permission, not FSSAI.
Also, doctor, we had seen that there was an order in 2022 which actually, allowed such products to come into the market, and they just had to carry a disclaimer, which often used to be missed
Actual order was on 8th April 2022, which said that they should not use ORS on the label. But on 14th July, they changed that order to companies with valid trademark can continue using ORS on their label, but with a disclaimer, this is not an ORS.
But usually parents, and if people are actually buying this for consumers, you can miss that small disclaimer. So now that
you can miss, and their argument was it's parents' responsibility to read the disclaimer. Yes, it's parents' responsibility to read the label, to read the disclaimer, no doubt about it. But tell me, how many Indians will be able to read disclaimers and understand the meaning of a disclaimer?
Absolutely.
It's criminal.
Also,
I'm going to the pharmacy and asking for something to save my child's life, and you're giving me something which can kill my child. I'm being blatant about that. It's a tragedy.
It absolutely is, doctor. Also, how do we ensure going forward that such fake ORS...
Government has to implement this order.
Right.
They have to implement this order. They should not let these companies get any stay order on this now.
But doctor, we have also been seeing cases of, contaminated cough syrups, and we've lost almost 22 innocent lives because of that.
Again, so drug regulatory authorities' failure, right?
Yes. So going forward, what do you think, what measures should be taken to ensure that such things do not happen?
We have to clean up the system. We have to clean up the system. We have to make sure drug regulatory authorities do their work properly and not give permissions for so many confusing cough syrups and multiple combinations, irrational combinations. They say they give permission for drops and they say don't use it for the children. I mean, it doesn't make sense, isn't it? So we should have strong quality control where we have only few brands and preferably only single drug formulations rather than combination drug formulations, and quality control is so strong that if I write generic name, the people should be able to buy any brand and get the same quality of medicine. Then I'll be confident as a doctor to write generic name without having to say, okay, this generic name and you have to buy this brand. Because there are so many poor quality medications. If I write only generic name, then if the patient, something happens to the patient, again the onus is on me, and my responsibility is towards my patient, towards the child more than anybody else. So have few formulations, few brands, and maintain strong quality control. Don't give permission for irrational combinations.
Doctor, how long do you think this entire procedure will take? Because you're asking for, specific set of regulations to come into place.
Form a committee of pediatricians and other doctors, a scientific committee, take their inputs, start the process. Once you start the process, it will happen. If the government decides to do, it can do anything, right?
Absolutely. Also, what is the advice for fellow doctors, because and also for parents who actually buy ORS on a daily basis, but this has to be doctor recommended, it has to be prescribed by doctors. So
First,
what
parents,
advice?
not only about ORS, about anything, learn to read the label, see the expiry date, and see the prescription properly. If it's not legible, you have a right to ask your doctor to explain to you clearly and write it legibly. Check the composition, buy accordingly, give the right dose, keep medicines out of sight and out of reach for your children to prevent accidental overdose. Always check twice, thrice before giving medicine to your child. Don't repeat prescriptions. Give medicines only when doctor has prescribed. And to the doctors, please write legible prescriptions. Explain to the parents that they should give the medicine only upon the prescription of the doctor, not randomly, and not to repeat the prescriptions, and to keep medicines out of sight and out of reach. Doctors also have to tell the parents. And very importantly, doctors on social media, please stop giving social media prescriptions. That is nonsense.
Absolutely, doctor. We are also seeing so much of misinformation on social media, like you have mentioned. So how do you think we should deal with that?
Deal with that. The law is there, but they have to implement it. NMC is not implementing its rules. So social media, no doctor is supposed to endorse products. So many people are endorsing products, so many doctors. We're not supposed to give social media prescriptions. It's happening everywhere.
Right. But clearly this is a very big battle that you have won for child healthcare in India. So congratulations on that front. It will be in fact good for the entire country. And thank you for your time and for speaking to NewsX on this entire issue.
Thank you.